My grandmother had breast cancer twice. At this time, some of her sisters had breast cancer. I had a cousin that had passed in her 40s. And so I was well aware that breast cancer ran in my family, but no one 25, 26 years old.
So Jasmine came with history of bloody nipple discharge. And she already had some breast imaging done, and she was told it's normal, and the level of suspicion at somebody at her age is very low. So nothing further was done. But due to persistence of her symptoms, and she was very health conscious.
And one thing that I loved about Dr. Jasra is that she didn't settle on inconclusive results. She said, if something's not right, we need to figure out why it's not right.
So I evaluated that further with an ultrasound, which also actually came back unremarkable. But our level of suspicion was still high, so we went ahead and did MRI of the breast that did show suspicious findings in the same breast. And then we proceeded with getting biopsy to diagnose it further. I think the most difficult part of all this is disclosing results of cancer to anyone, and especially somebody young who are absolutely not expecting a news like that. But right after that, she was determined to get over all this and move ahead with the treatment and conquer this problem.
I feel like I had amazing doctors. I was blessed with an amazing team.
And we do discuss their care in a multidisciplinary manner, starting from the day of diagnosis, and continue to do that throughout their treatment to make sure they are getting the best care possible.
I felt like an outlier in the breast cancer community, first as a young woman and then as a Black woman. Then I had the opportunity to connect with other young women at the Young Survival Coalition. And all of that information just felt like if I was looking for a moment to not play small, this would be it. I took those experiences, I did some research, and co-founded an company called For the Breast of Us. And it was the first online community for women of color affected by breast cancer. And our whole goal is to help women make the rest of their lives the best of their lives after a diagnosis. And that means once you're diagnosed, you need to learn how to advocate for yourself. You need to know what kind of questions to ask. You need to know what kind of resources exist. And you need community. You need to be able to connect with women who look like you and understand what it's like to go through these experiences.